it's really important that we're not just tinkering around the edges, but we take every opportunity to absolutely transform the environment within which we're in. So what that can look like is that there's grassroots things we need to do, there's operational changes we need to make, and then there's the more strategic policy-oriented areas of health that we really need to transform.
Developing an environmental sustainability coordination across the health service, providing the resources to deliver on accountabilities, and giving sustainable healthcare champions that are doing this work often already anyway, giving them something to point to when they're engaging their colleagues in their sustainable healthcare journey.
I think there's no doubt that we've squandered the last decade, and which is unfortunate because Australia has a lot to offer when it comes to the transition that's so desperately needed. We're a country blessed with a lot of sun and wind and resources that are actually needed for that transition.
We're just beginning the journey. So there's very few health services around the country that are taken seriously, that have already appointed sustainability officers or departments or people and teams looking after this. And then there's obviously a system-wide level. So in the state governments and the federal government, we need kind of flanking action and support for this, also reflected in the financing streams, etc. It's a complex issue and it needs complex solutions and it needs to be taken seriously.
So in health, it's really important that we don't just change the rules, but we change the game. So what that might look like is, for example, Choosing Wisely is a really critical program around reducing low-value care. That's changing the rules. Changing the game is shifting towards a value-based healthcare approach, shifting coal pathways and redesigning our systems and services around that.
At the moment, they're working on a national climate change and health strategy, which will be released by the end of the year. And that also has mitigation as one of its main objectives, and also adaptation for the healthcare sector to climate change impacts. So I think there's a lot of progress that's happening right at the moment, and it's a great time to be involved in this space.